Before we going to talk about this topic, let's watch this video first.
Mental health is not going good. Also ich war sehr oft traurig, muss ich sagen.
Ich bin depressiver geworden. Ich war jetzt selber auch in Quarantäne und das hat das alles noch sehr verstärkt.
Einsam, ja, oft sehr traurig. Schlafen kann ich auch nicht mehr gut, gar nicht.
Ich kenne auch Leute, die wirklich Selbstmordgedanken hatten.
Assalamualaikum and hi everyone. My name is Nur Atika binti Hasnan and my metric number is 286766 and this is my partner.
Hi, my name is Normanisa binti Roslan. My metric number is 286918.
Today we want to present about healthy and medicine. So our title for this video is mental health problem during pandemic COVID-19. Mental health is very important in our life. This is because a healthy life can get a better life. Okay, mental health problem or also can call mental health illness. It refers to one range of mental health condition. Mental health problem is disorder that can affect your mood, thinking and behavior.
The importance of maintaining mental health. Mental health is very important for everyone. This is because with a good mental health, it can guarantee the productivity of the work we perform and can do our daily life well. Other than that, a person with a good mental health can think rationally and can make wise decisions in their life. In fact, mental health is also important in order to avoid becoming overly stressed and depressed. This is because with a good mental health can give a positive aura in a person which makes them not easily feel depressed. In addition, with a good mental health, it can also lower the risk of getting the disease, for example, heart attack disease and high blood pressure. This is because with a healthy mental, it can make a person feel more fit, feel more better, and also it can make a person feel more healthier.
Mental health is something we all have. It includes our thoughts and feelings about ourselves and others, how we relate to other people, how we function day to day, and how we cope with the ups and downs of life. Having good mental health is not about having no mental health problems. It's about feeling good enough about ourselves, being able to do the things that matter to us, and having the resilience to deal with the difficult situations we all experience in life. When talking about our mental health, it can be useful for us to think of it like a scale. Our mental health scale will move towards good or poor mental health depending on what's going on in our lives and the supports we have around us. There are things that can challenge our mental health and shift the balance of our mental health scale. These challenges can come and go over time. They may be brief or may last for many years.
So from this video we can see how important mental health is to ourselves, so our daily life more cheerful and have a stable and a strong mentality and controlling our emotion and feelings.
The factor that can cause mental health problem during this pandemic COVID-19 is due to the stress of life. For example, there were some people who lost their jobs during the COVID-19 era because they were laid off by their employers or could not do any work because all sectors were closed, making it difficult for them to continue their life and support their family to earn income and daily necessities supply. In addition, there are also some people who feel worried or anxious about this COVID-19 disease because they are fear of being infected and spreading, causing them to feel depressed. Movement control order implemented by government have also caused many people to feel stressed as they are unable to carry out the daily routine such as going to work, going to school, going sightseeing, and so on, causing them to feel so bored. And there are no activities to do other than watching television, sleeping, and eating. It causing them to all start overthinking often about things that can be stressful and negative.
Okay, next, mental health problem have many of types that we can know through their symptom. So now I want to explain that types of mental health problem that usually we see and people face it. Firstly is anxiety disorder. Okay, who that face it will feel tired, muscle tension, stomach and chest tightness or pain, fear of embrace, blazing, sweating, shortness of breath and headache. So anxiety disorder will make someone feel useless. That's why they always stay alone. This is due to someone that always think about their family situation when the money was finished and no ways to get money. Okay, next, secondly, the types of mental health problem is mood disorder. Nowadays, this type is usually happen to people in Malaysia. Mood disorder are also known as affective disorder, and they involve persistent grief and sorrow alone or combined with periods of happiness. Some of the most common mood disorder include bipolar disorder, depression, loss of appetite, low energy, and needing less sleep. Okay, last but not least is eating disorder. Okay, in this type of mental illness, sure we not realize, right? Eating disorder involve abnormal thoughts or behavior about food and weight and may cause people to eat too much or too little. Eating disorder can lead to heart and kidney problems. Common eating disorder include anorexia nervosa, bulimia nervosa, and binge eating.
The way to overcome and treat this mental health problem is for patients to see a counselor or specialist for guidance and treatment regarding the level of their mental health problems. Therefore, they are able to share and express their feelings so that their voice are heard and can solve their problem. So their mental health problems can be reduced little by little and not becoming worse. And if your mental health conditions becoming worse, you should immediately seek follow-up treatment in a hospital, as the disease is very dangerous, as you can commit out of control actions such as suicide, self-harm, hallucinations, and talking alone. So if you go to the hospital, the doctors can detect and treat your disease with medications and therapy, so your mental health problem can be immediately treated and cured. In addition, people are also advised to do a light exercise a day or twice a day, so that the brain becoming more active and does not feel too stressed, such as aerobic and push-up. With the family, we also need to plan and implement beneficial activity with the family during movement controls. This is so that your family does not feel bored and happier without having to think about negative things. For example, washing cars together, trying to cook a new menu of dishes, and kids watching televisions and chatting together. From these various activities performed at home, you'll not to overthink about negative things that can cause anxiety or stress in yourself.
In conclusion, the pandemic COVID-19 is seen to be highly impactful and affect mental health problems in the community. This contributes to the number of cases that can lead to death, such as suicide and so on. The COVID-19 cases that hit up also the movement control orders, or we known as MCO, have also caused many people to feel stressed and depressed. Their brains start to feel tired and bored when not doing any kind of work throughout the movement control order, such as working, going to school, and doing business. Therefore, as a positive and wise society, we need to take a good care of our mental health and not to be overwhelmed by negative feelings that can have a negative impact in our mental. Good mental health can bring a good lifestyle in our future life. That's all from us. Thank you.